Hi guys, again, this is Dr. Rupesh from Dr. BKM Institutes. Now we are covering one more thing, that is reading part A. Reading part A, again, the major problem or major challenge, sorry, it's not a problem because it's a resolvable problem. The major challenge when it comes to reading part A is that you have to complete that task in 15 minutes. Now, everybody has different strategies. Our strategy, being Dr. BKM, has been very successful. How to finish reading part A in time is first. Start from question number one. Some people start from question number eight. Never. Start from question number one. Second strategy, if you are unable to find anything, please leave it. Time is very important. In the first time, just try to go through the reading part A, that what your reading is all about. Suppose now, if I take this reading in, trust me, I have not done it, and it's a very big reading. In exam, this kind of big reading will not come. Still, I am trying to do this reading just to tell you. Now, if you see, first paragraph is about investigating acute transfusion reactions. Record the following information: type of infusion, length, volume, blood donors, antigen, antibody, anti-screen. So they take talking about acute transfusion reactions. Take the following samples, full blood count. They are talking about how to do that. Record the result of investigations. So the whole paragraph A is about investigation. Second paragraph is about drugs and dosage notes, relevant effects, bronchodilator, expand volume, oxygen. These are the kind of the words that are given. Third is about symptoms and possible cause. Category has been given. So that means category means that they have given the patient mild, moderate, severe, or life-threatening. So they have given the signs, symptoms, and hypersensitivity reaction, possible causes, antibodies, platelets, and all these words. Then the last paragraph D is all about immediate reaction, life-threatening situations. That was also given, but yeah, maintain airway. So they are doing the treatment part. If you understand immediate reaction, maintain airway, so they are doing some treatment part. Now in the exam, if I say first question, the correct route of administration of chlorpheniramine. So now I know it should be in B because drugs were given. See, it should be over here. There you go. One question done like that. Question number two. The likely cause of rigor and fever. Rigor and fever, likely cause, possible cause, rigors and fever, possible cause, rigor and fever, febrile, non-hemolytic. But again, we just have to write A, B, C, D in 1 to 7 questions. C is the answer. Can you see that? The best way to describe patient symptoms. Symptoms either this or maybe from A part, because they were saying record the symptoms or something like that. But yeah, otherwise C. C I think is a better option. But this option I'm not sure. But yeah, C can be one of the best way to describe. I hope these are the symptoms. Done. Initial steps to take when treating a critically ill. Critically means life threatening. Initial steps: maintain the airway. Fourth answer should be D. इकट्ठा ही तो किया हम सबने. The various symptoms who have had a transfusion reaction. Transfusion reaction symptoms. This also should be the answer. This, as far as I think. Then, where the document findings of appropriate investigations. A. The effect of the various medications for managing patient symptoms. Effect of various medications. This B. Effect of various medication, there must be some effect. Hyposensitive or this. But medications are given over here. There are no medications given over here. So at last, medications are given over here. These are the only medications. Now, by chance, this was looking difficult, but little easier. The only answer I am confused is third, because I said the best. Can you see degree? So there must be a degree around here. The best. That is why I taught you this grammar today. The best would be replaced by something with the something. Again, would be coming with the superlative degree. In the फाइनल एग्जाम फॉर श्योर. फाइनल एग्जाम में ये रूल्स पक्का फॉलो होंगे. अगर द बेस्ट दिया है तो वहां पे भी द मोस्ट, द हाईएस्ट ऐसा वर्ड होना चाहिए, इसीलिए मैं इसको लेके कंफ्यूज हूँ, नहीं तो ऑलमोस्ट डन है। सो इन एग्जाम में आउट ऑफ 7 क्वेश्चन 2 क्वेश्चन वुड बी डिफिकल्ट। तो उन 2 क्वेश्चंस को आपको डीप में नहीं जाना पैराग्राफ के। वेन एवर यू विल गो डीपर इन टू द पैराग्राफ दैट मीन्स नाउ यू आर वेस्टिंग टाइम। तो 7 में से 5 और 6 क्वेश्चंस करने हैं बस, दैट्स इट, दैट्स इट। 5 और 6 क्वेश्चंस, इससे ज्यादा नहीं करने। ओके, नाउ कम्स द नेक्स्ट थिंग, क्वेश्चन नंबर 8। इफ यू विल सी नाउ प्लीज, now try to understand why did we do from question number 1 to 7. I don't know what's happening. Laptop is playing a little, but anyhow we will focus. 1 to 7 questions. Now see the benefit of doing 1 to 7 question. Question number 4, how long should a patient's urine be collected and documented? It should be in the A. For how long? Urine collection by chance I can see here. D. By chance. So if I couldn't find in A, by chance I could see. So having these words like collected, I can see collection, and now this was an easy answer for me, having the word collection over here. So this was a little easier. Then what? Just a second, I have to sort it out. I don't know what's it up to. Just give me 1 second. Just 1 second, guys. Sorry. Got it. Yeah. Okay. I don't know where is it playing up with. I can't see anything. Sorry, guys. Kindly bear with me, and we will focus, even if it's deviating our mind, but we will try and focus. Okay. Then, how, what should be used to appropriately transport a blood culture? Transport a blood culture. Now the word is blood culture, and appropriately ly word. Again, please try to focus. Appropriately word would be given somewhere. Culture. Can you see culture word? It should be in A, I guess. Culture. Appropriate. Blood culture bottle. So bottle is what is required. So I have to fill the word bottle. What should be used to appropriately? So that is given as bottle or something. What was the answer? So means it's just about A part is the damn easy part. You have to improve your power of skim and scan. So what I did, why could I find this answer? Please try and understand, because I did 1 to 7 question. I did not start from 8th question. I started from 1 to 7. Now my mind knows where should it be, A, B, C or D. It saves my time. I directly go on to A and say, blood culture bottle. Are you getting my point? Then how long 0. 0.9 saline be given the patient if the patient is hypotensive? Again, it should be hypotensive, should be here in the symptoms or something. Hypotension or saline. Maybe over here, or it should be over here or this. 0. 0.9 saline. Here you can see hypotensive. 20 milli per kilogram over 5 minutes. How long? Over 5 minutes. See how easy can we find this? Like, so do only those questions which are easier to find. Okay. What type of admission is warranted for a patient having stridor? Stridor means symptoms. Stridor, symptoms, stridor, no. Stridor, it should have been somewhere around here only. Stridor. I cannot see it. Can anybody see that stridor? Should have been here. But now I can't see that. So now, in the final exam, if you are unable to find, please don't take it to ego and just leave it. अगर स्ट्राइडर यहाँ पे मिलता है, what type of admission? वैसे admission should come in immediate reactions, because ये भी तो precautions ही है ना. So यहाँ पे अगर हमें स्ट्राइडर वर्ड मिल जाए तो जल्दी में नहीं मिल रहा. सो बेसिकली अब आप प्लीज ध्यान से देखो, कई वर्ड्स ऐसे दिए होते हैं आपको नहीं मिल रहा है, अब पेपर में आपको लगता है ये तो हो ही जाएगा, बस ये नहीं करना. Leave this question. This is the most important instruction of reading part A. Out of the first 7 questions, 2 would be difficult. Then there would be 2 or 3 more questions which would be hard to find. Otherwise, obviously, we can find the word strider. It should be somewhere around here. But when I'm unable to find it, I should not overtry. वैसे तो of course है ना, मतलब मन करता है, जैसे अभी मेरा मन कर रहा है. That is what exactly is going to happen in exam. कि ढूंढ ही लेते हैं, मिल ही जाएगा, लेट्स फाइंड इट, लेट्स ट्राई टू सॉर्ट इट आउट, ऐसे मन में चलेगा. बट यू हैव टू अवॉइड दिस. ठीक है, मेरे को अभी मिल ही नहीं रहा स्ट्राइडर वर्ड. इट्स एक्चुअली टेकिंग माई एनर्जी. इट शुड बी समवेयर हेयर वैसे, बट आई एम अनेबल टू ट्रेस इट. या सो देखो, अब देखो कितना टाइम वेस्ट हो गया. अगर सपोज इफ दिस वुड हैव बीन माय फाइनल एग्जाम, मैंने एक क्वेश्चन ढूंढने के लिए कितना गलत किया. इट्स नॉट द राइट थिंग. What might a category 3 patient show more than a 20% drop in? 20% drop किस में आया है? 20% ड्रॉप, ये वर्ड अलग से दिखना चाहिए. 20% ड्रॉप मीन्स कहीं पे 20%, क्योंकि परसेंटेज यहीं पे ज्यादा दिए हैं. सो आई वॉन्ट टू फाइंड हेयर अराउंड 20% ड्रॉप इन. 20% is a very conspicuous word. It should be visible. Can you see guys 20% यहाँ पे? Okay. 1/5 or 20% drop. Mhm. It should have been visible वैसे, otherwise 20% drop. Because 20%, these words are easy to trace, they should be very visible. But again, see, the easier questions have become difficult. I don't know how. Oh, but there is one thing I have missed. Category 3. Now it's easy. See, category 3 में ही होना चाहिए 20%. Drop, ये rise है. Fall off means drop. 20% systolic blood pressure. Now I can find it. Because again, why didn't I find it? Because I forgot the word category 3. When I read the word category 3 clearly, I know it should be over there. That is what it does. What is best avoided if a patient has a low platelet count? Low platelet count, again, it should be over here, treatment. Low platelet count, no, not given. Okay. Over here, low platelet count, low platelet count, no. Low platelet count should come over here somewhere. Low platelet count, no, I'm unable to find it. Low platelet count, no. So that is how I will skim. I am not finding this answer. I will leave this. So again, there are 2 questions, 11th and 13th. I could not find. Away and dash from the, again, see the importance of prepositions. Article A, preposition at. This is what I taught you today. This is something that's gonna make your life easy. Suppose if I say a nebulizer should be administered at 5 mg, so I just have to find the word first, 5 mg. 5 mg nebulizer, 5 mg if it is given somewhere. 5 ml, sorry, nebulizer, 5 ml. Here it is given, and it should be at, inhibits immune mediated, but there is nothing like at. Okay. In this it cannot be. Over here, can we find something like that? A nebulizer should be used to administer dash. But okay, what are they administering? So now the question is, what are they? Salbutamol or this aminophylline. This should be the answer. What should be administered? देखिए. So reading the question, should be used to administer this drug at this, at 5 mg. If a patient experience pain close to, it is likely to be classified a dash reaction. If a patient pain close to site of infusion, it is likely to be considered a reaction. So I think classification, it should be given in the classification. And if it is close to the site, so I have to word close. I have to find the word close. So these are the small. A word is given over here, but it's not given in a way. No. Okay, we go to here. Close to the site. Something like this has been given close to the site over here. No, I can't find it. So I will leave this question. That is what, again, you have to carry on with. Site of infusion, if I can see the word site of infusion over here. No, it's not coming to me. Mhm. Can anybody see site of infusion? No. Site of infusion, but it should be in the part A. That's why I went on to the part A. I was thinking that it should be somewhere here near the site of infusion. That is the word. Mild hypersensitivity, transfusion reaction, site start of transfusion, but not infusion. No, site word is not given. So again, see, the more I am trying, the more the time is getting wasted because I think it should be easy, but I'm not finding it. It is it, but by chance, I'm just telling you, Strider word has come to me. That is what I exactly. These words are easy to find, but they are hidden somewhere in the end of the lines. If they would have been in the middle, our eyes trace it, like collection word came to me straight away. But when they are hidden sideways, that is where it becomes. Now I will do that Strider wala question. Strider wala question was which question? Yeah. What type of admission is warranted for the patient is this. What type of admission? Stop the transfusion replacing is managing anaphylaxis protocol, critical care admission. So now I have done this answer. That is where you have to have patience. See, how did I found that answer of Strider? By chance. So that is where you save time. So otherwise, at that point of time, my eyes were unable to trace it, but by chance it came to me and I said, okay. So that is what will happen. So if you will give yourself chance and positivity, it will happen. A vein from the dash should be sample collection. A vein from the dash. IV line open. A vein word is given over here, but IV, but again, it's not, again, not easy to find. Vein word, it should be in the paragraph as far as I think, vein word. So vein word, blood samples, it can be in the blood samples. Yeah. So again, if it's not matching up, then I have to leave this, but should have been in the part A, but yeah, vein, or it can be in this as well, vein, because they're talking about samples. So it can be in there. बट चलो एनी हाउ नहीं मिल रहा नेक्स्ट क्वेश्चन ये बहुत इंपॉर्टेंट है टू कीप मूविंग एन असेसमेंट फॉर ब्लीडिंग फ्रॉम डैश शुड बी कंडक्टेड इन एन emergency situation assessment for bleeding from dash emergency situation bleeding or emergency situation is this but bleeding word is not given so this is again so this is the method you have to go on with and carry on in your exam whatever you can find again I'm telling you in the final exam it would be much lesser. This is too much data. इतना बड़ा paragraph नहीं आएगा final paper में. It's just a practice thing that we have to do. But लेकिन this is how you need to do it. 1 to 7 questions. Then you keep estimating where should the answer be. By chance again. I left the question. I left the question. Now I can see the word vein as well. Please understand. You just need to carry on, carry on. Vein in the opposite arm. From. From that is what I taught you today. Importance of preposition and articles. And now see, from a vein in the opposite arm. So you just leave it a vein from the opposite arm. From the. So from word replaced by from a vein from the opposite arm. So that is how you will do it. There it is. So you will find these. It's by chance sometimes they do not hit your eye, but you now know the question. By the time you are doing other things, you will find that thing. That is how it will happen. But you have to give yourself a chance. Even after teaching you all these things, I have taken around it is showing 20 minutes, but maybe we would have started after 5 minutes. Now 15 minutes have got over, basically, of this recording. कितने ज्यादा होते हैं 15 minutes आपको even after teaching you I still have time and I am almost at the end अगर मुझे आपको पढ़ाना नहीं है तो मैं बस स्किम स्कैन कर रहा हूँ 1 to 7 so that is how fast it would happen if you will follow the right technique again I will sum up the technique only easy question first start from question number 1 try to understand a paragraph is about collection blood collection second paragraph was about drugs Third paragraph was about categories, rigors, titers, symptoms, and signs were given. Fourth paragraph was about immediate reaction, how to tackle the patient. That is, you should know the topic. And out of 1 to 7 questions, 5 questions will happen in just like, what should I say, 2 or 3 seconds. Because you will do paragraph ka scanning. Ye first paragraph is about treatment, third paragraph is about this, fourth paragraph is about diagnosis. You scan the question number 1 to 7 and you do 4 to 5 questions. So that is how you do it. This is Dr. Bhupesh for you guys to tell you how to do reading part A and how to complete that part in 13 minutes, less than 15 minutes. Each and every question, you should save your time. Thank you very much.